Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In today's video, we're going to talk about schizotypal personality disorder. Now, schizotypal personality disorder has similar features to schizophrenia, but the features are less extreme, especially when it comes to ideas of reference, which I'll explain when I get in there. And a person would not meet all of the criteria for schizophrenia. So there's some overlap between the two. But without further ado, let's talk about schizotypal personality disorder. So schizotypal personality disorder is characterized by a range of interpersonal problems marked by extreme discomfort in close relationships and even bizarre or odd ways of thinking and behavioral eccentricities, right? So an example might be ideas of reference. Now, an idea of reference is something that's happening in the environment which a person personalized and thinks is a message for them. And that the reality is that it's not, right? So there are no secret messages in the newspapers or on the signs or things like that. But an idea of reference is held to a lesser degree than a delusion of reference, right? In schizophrenia, we talked about the concept of delusion of reference, and that's a person who has similar ideas, but no matter what evidence you present, they hold on to this belief. Ideas of reference are not as strongly held, and if you can present sufficient counter evidence, the idea will fall aside. Bodily illusions or sensory perceptual experiences within the body that are misunderstood. So in terms of thought processes, a person with schizotypal personality disorder has really difficult time keeping focus. And even when you think about how they speak and their thought content, there's very vague, tangential, and sometimes even loose associations between ideas. So that's the introduction, but I want to give you the DSM-5 criteria. Now, with many of the personality disorders, you will see that you need 4 criteria. With schizotypal personality disorder, you need 5 of the following. You need the ideas of reference, which I talked to you about, odd beliefs or magical thinking, so superstitions, things like that, but it can't be related to some cultural belief set. It has to be an idiosyncrasy of the person. Perceptual disturbances or unusual perceptual experiences. We talked about thinking and speech. So a person could have very vague or circumstantial, tangential speech. You could have suspiciousness or paranoia, similar to a paranoid personality disorder. You can have a restricted or constricted, inappropriate affect. You could have bizarre, odd behavior or appearance. You will see that there's a lack of close friendships and confidants. This is naturally because there's a distancing between the person with schizotypal personality disorder and those around them, perhaps due to some of the suspiciousness we mentioned earlier. And then there's a social anxiety that doesn't subside even as you become more familiar with a person. And it is linked to some level of paranoid fears rather than self-criticisms. Now, as I said, these are 9 criteria. You don't need all 9. You need 5 out of 9. And it cannot be better explained as a function of things like schizophrenia, bipolar disorder, another psychotic disorder, autism spectrum disorder, right? So we have to rule those conditions out to give a schizotypal personality disorder diagnosis. As with all personality disorders, these are chronic conditions. So they are going to occur across the lifetime. But we don't typically diagnose personality disorders until the age of 18. And we need a minimum of 6 months of track record to feel comfortable giving a diagnosis. So, but 6 months, it's going to last for a lifetime. So that's the DSM-5 criteria. So what does it practically look like, right? So people with schizotypal personality disorder kind of wonderlessly aim, they drift from thing to thing. Many times they're not as productive as they could be, or live idle or unproductive lives. They tend to take jobs that are not very demanding and don't require much contact with other people. And that's similar to schizoid personality disorder, right? So when we talked about schizoid, there's this aloof distance, but it's more of an apathy for other people. When it comes to schizotypal personality, this is more of a suspiciousness. And it's slightly more common amongst males relative to females. So how do we explain schizotypal personality disorder? Well, we explain it very similar to the way we explain schizophrenia, because it looks like there are similar factors at play. So schizotypal symptoms are linked to family conflict, psychological disorders in the parents. From a biological point of view, we see high dopamine activity in both cases. So schizophrenia, one of the reasons for hallucinations and delusions are excessive dopamine activity. Same thing with schizotypal personality. And we also see that schizotypal personality is linked to other mood conditions, especially depression. And I think I said we had to rule out bipolar disorder as well. So how do we treat it? Well, treating all personality disorders are difficult, but schizotypal personality disorders are very, very challenging, and treatment is very difficult. There tends to be some suspiciousness amongst the clients to their therapists, and you have to go slowly to build the trust. And one of the goals, though, is to try and help clients reconnect with reality, right? Because there's this disconnect between the belief set and what's really going on. Not as extreme as schizophrenia, but there's not a full break from reality like schizophrenia, but there is a disconnect. So our goal is to help our clients reconnect to the world around them, and then to start to challenge or identify the limits of their thinking and their powers, right? So if you think that you have some kind of superpower or whatnot, we have to help you challenge that. And so what do cognitive behavioral therapists do? They help their clients be more objective in evaluating their thoughts and their perceptions. And in terms of speech content, so we will provide things like speech lessons to make sure that the speech is coherent, logical, very connected. And as it relates to, that social anxiety, we'll provide some social skills training. Now, here's an interesting one. I've been talking about in cluster A that medication hasn't been that effective for things like paranoid personality disorder and schizoid personality disorder. When we see schizotypal personality disorder, because it's similar to schizophrenia, guess what? Antipsychotic medications actually work and are somewhat more helpful than in other cluster A conditions. So it's going to reduce some of the thought problems, reduce some of the ideas of reference and things like that, which is pretty cool. So that is schizotypal personality disorder. Schizotypal personality disorder, if I were to recap, is a cluster A personality disorder. So it has odd and eccentric features. It is patternistically similar to schizophrenia, but not as extreme in terms of a break from reality. And these conditions are somewhat more receptive to pharmacotherapies, which is pretty cool. So if you found this video helpful, give me a big thumbs up, click the like button, subscribe, click the notifications tab. That allows YouTube to identify this as valuable content. They keep track of it for their algorithms. And if that is the case, they're going to share it with a broader audience. And if in doing so, you will help me fulfill my mission to make psychology accessible to all. So that please like, subscribe, click the notifications tab. But more importantly, if you do none of that, if you found this video useful and it stimulated a question, put it in a comment section. And I want to turn this into a learning community. So if you have a question related to the content, or you have a thought that is provoked by the content, put it in there. I read and respond to every comment. And I hope to hear from you soon. So until next time, take care, everybody.